Good morning, Silungile. Just to put things into perspective, how bad is this shortage?
Good morning, Nandi. We have been experiencing declining blood stocks. At the moment, we are just on about less than 3 days, enough to meet the blood demand in the country. So we are appealing to those who are eligible to donate blood to go and visit their nearest donor center to help us just bolster the stocks during this time.
How has COVID-19 changed the routine work that the SANBS does?
Well, blood collections rely on sustainable planned corporate drives and school drives and universities. And because of all the restrictions, for example, people are not going to work as often as they used to. So that has severely impacted our collections. Even the schools are not back to their normal schedules, the universities. So we haven't had access to the normal places where we traditionally go and collect blood. So in the background, we are still trying to arrange with body corporates to allow us access to at least go to where the people are so we can meet the demand in the country. So at the moment, at the time, please, we are appealing to those who can at least visit their nearest donation centers while we are working around mechanics to reach the donors where they are.
Silungile, during this COVID-19 era, I think that we can agree that there is a lot of panic and a lot of fear. Could it be that people who would usually donate blood are concerned about how safe it is?
Yes, understandably, there is a lot of fear around the COVID-19 pandemic, but I assure all donors and potential donors that it is still safe to donate blood. Even during the peak of the COVID-19, blood donation was considered essential. So we've taken all the precautionary measures to make sure that our donors are safe. So it remains very safe to donate blood. We've always had strict protocols in any case, even before COVID.
All right, so let's say I am someone who's on my way to go and donate blood. What safety measures and protocols are in place to ensure that I am safe and I feel safe?
So all our donors are pre-screened before a donation. The social distancing is adhered to. All the alcohol swabs and sanitizing is in place to make sure of the safety of the donors. The screening questionnaire is there, and anybody who's got flu-like symptoms is deferred for about 7 days until they feel better. And we are advising that anyone who has flu-like symptoms to delay blood donation until they feel better, and because it's safe for everyone concerned.
So now, considering the shortage that is currently being experienced, how much blood through these blood drives that can hopefully be put together, how much blood needs to be collected on a daily basis on average?
On a daily basis, we need about 3,500 people nationally to just present at our donation sites in order to meet the demand. We are comfortable, if we're sitting on about 5 days of blood stock, we are comfortable that we can meet the demand in the country. So about 3,500 people nationally on the daily basis.
And I know it is predominantly blood group O that is needed most. Why is this the one that is needed the most, and why is it so rare?
Correct. The blood group O is needed because it is the universal blood type, which means it can be transfused to almost anyone, especially in emergencies, without risking adverse reactions.
All right, so let's try to find a solution here. How can companies and the everyday person assist the blood service right now and help save lives? Silungile, are you there?
Yes, hello?
Yes, I don't know if you heard my last question. I want us to try and find a solution.
Sorry, I didn't get that.
All right, now I want us to try and find a solution to the problem. How can companies and the average everyday person help save lives and help the National Blood Service?
Firstly, especially for the public places and places where communities congregate, we are appealing for the public to give us suggestions on where we can come. And they can do this via our website, sanbs.org.za. That's where there is a form where you can suggest where we can come and collect blood, especially because so many places are closed and there are restrictions on numbers where people gather. So if the public can come forward and let us know where we can come and which public spaces are available for us to conduct mobile blood drives, that would help us a great deal. And anyone who's over the age of 16, if they can visit their nearest blood donor center, all the centers are listed on our website also, sanbs.org.za. and we can help save the lives of so many South Africans.
All right. Thank you very much, Silungile Mlambo, Chief Marketing Officer at the South African National Blood Service.